Every year, millions of people rely on EpiPens to effectively manage life-threatening allergic reactions. But have you ever wondered how these small devices work? In this video, we'll take a closer look at the mechanics of an EpiPen, from its inner workings to its uses and potential side effects. How does an EpiPen work? An EpiPen is designed as a user-friendly, portable device that can be easily administered in emergency situations. The key component of an EpiPen is the medication it contains, called epinephrine. Epinephrine, also known as adrenaline, is a hormone naturally produced by the adrenal glands. When released into the bloodstream, it helps to constrict blood vessels, relax smooth muscles, and increase heart rate and blood pressure. The EpiPen works by delivering a precise dose of epinephrine into the body through an injection. The device consists of a spring-loaded mechanism that drives a needle into the thigh muscle, allowing the epinephrine to be quickly absorbed into the bloodstream. The needle is relatively short, typically around 1.3 centimeters, which minimizes the risk of hitting a bone or an artery. Once the needle is injected, the epinephrine begins to take effect within minutes. It works by binding to specific receptors in the body, known as adrenergic receptors. By stimulating these receptors, epinephrine helps to reverse the symptoms of anaphylaxis, a severe allergic reaction. These symptoms may include swelling of the face and throat, difficulty breathing, hives, and a drop in blood pressure. Epinephrine acts as a bronchodilator, opening up the airways, and also helps to reduce the swelling, allowing for improved breathing and increased blood flow. Common uses of EpiPen. EpiPens are primarily used in cases of severe allergic reactions, known as anaphylaxis. Anaphylaxis can occur as a response to various allergens, such as certain foods, e.g., peanuts, shellfish, insect stings, medications, or latex. When an individual experiences anaphylaxis, it is crucial to administer epinephrine as quickly as possible to prevent further escalation of symptoms and potentially save their life. In addition to anaphylaxis, EpiPens may also be used in certain medical procedures, such as during anesthesia, where allergic reactions can occur. It is important to note that EpiPens should only be used in situations where there is a known or suspected severe allergic reaction. For less severe allergic reactions, antihistamines or other medications may be more appropriate and effective. Potential side effects of EpiPen. Like any medication, EpiPens do come with potential side effects. However, it's important to remember that the benefits of using an EpiPen in life-threatening situations generally outweigh the risks of side effects. That being said, it is still essential to be aware of the potential adverse reactions that can occur. Some of the common side effects associated with EpiPen usage include increased heart rate, nervousness, sweating, headache, and dizziness. These side effects are typically temporary and resolve on their own. In rare cases, more serious side effects can occur, such as irregular heart rhythms, chest pain, or difficulty breathing. If any of these more severe side effects are experienced, immediate medical attention should be sought. It is worth noting that individuals with certain medical conditions, such as heart disease or high blood pressure, may be more susceptible to experiencing adverse reactions from epinephrine. Therefore, it is important to consult with a healthcare professional to determine the appropriate use of an EpiPen based on individual circumstances. Safety precautions when using an EpiPen. While EpiPens are generally safe and easy to use, there are some safety precautions that should be taken into consideration. First and foremost, it is crucial to familiarize yourself with the device and its instructions before an emergency occurs. Understanding how to properly use an EpiPen can make all the difference in a critical situation. It is also important to check the expiration date on the EpiPen regularly. Epinephrine can lose its effectiveness over time, so it is vital to ensure that the medication is still within its expiration date. Expired EpiPens should be replaced promptly to ensure optimal efficacy in an emergency. Additionally, EpiPens should be stored at room temperature, away from direct heat or extreme cold, to maintain their stability. Finally, it is crucial to seek medical attention immediately after administering an EpiPen. While epinephrine can provide temporary relief from severe allergic reactions, it is not a substitute for professional medical care. It is essential to have a healthcare professional evaluate the situation and provide further treatment or guidance as necessary. Proper administration of an EpiPen. Administering an EpiPen correctly is crucial to ensure its effectiveness. The following steps outline the proper administration of an EpiPen. Remove the EpiPen from its protective case. Grasp the EpiPen firmly in your dominant hand, with the orange tip pointing downward. Form a fist around the EpiPen, with your thumb closest to the orange tip. Remove the blue safety release by pulling it straight up and away from the EpiPen. Hold the EpiPen with the orange tip close to the outer thigh, at a right angle to the thigh. Quickly and firmly push the orange tip into the outer thigh until you hear or feel a click. Hold the EpiPen in place for a few seconds to ensure the full dose is delivered. Remove the EpiPen from the thigh, being careful not to touch the orange tip. Massage the injection site for 10 seconds to help the epinephrine absorb into the bloodstream. Seek immediate medical attention. EpiPen alternatives. While EpiPens are the most widely known and commonly used devices for delivering epinephrine, there are alternative options available. One such alternative is the adrenal, which works similarly to an EpiPen but has a different design and administration process. Other alternatives include the AlV-Q and the Simgepi, both of which are compact autoinjectors that deliver a dose of epinephrine. It is essential to consult with a healthcare professional to determine the most appropriate option based on individual needs and preferences. Factors such as ease of use, cost, and availability may also influence the choice of an alternative to the EpiPen. Tips for managing allergies and when to use an EpiPen. While having an EpiPen on hand is crucial for managing severe allergic reactions, it is also important to take proactive steps to prevent allergic reactions and manage allergies effectively. Here are some tips for managing allergies and knowing when to use an EpiPen. Identify and avoid allergens. Determine the specific allergens that trigger allergic reactions and take steps to avoid them. This may include reading food labels, carrying an allergy card, or wearing a medical bracelet to alert others about specific allergies. Carry an EpiPen at all times. If you have a known severe allergy, always have an EpiPen with you. This is especially important when traveling or engaging in activities where exposure to allergens is more likely. Recognize the signs of an allergic reaction. Educate yourself on the symptoms of an allergic reaction, including anaphylaxis. Symptoms may include hives, itching, swelling, difficulty breathing, and a drop in blood pressure. Act promptly. If you or someone around you is experiencing severe allergic reactions, do not hesitate to use an EpiPen and seek immediate medical attention. Time is of the essence when it comes to managing anaphylaxis. EpiPen expiration and storage guidelines. As mentioned earlier, EpiPens have an expiration date, beyond which the medication may be less effective or potentially harmful. It is crucial to check the expiration date regularly and replace expired EpiPens promptly. Additionally, proper storage is essential to maintain the efficacy of the medication. EpiPens should be stored at room temperature, ideally between 15-30 degrees Celsius, 59-86 degrees Fahrenheit. They should be protected from direct heat, such as being left in a hot car, as excessive heat can degrade the medication. Freezing temperatures should also be avoided, as they can cause the medication to become less effective. It is important to keep the EpiPen in its protective case to shield it from light and physical damage. Conclusion and final thoughts. EpiPens are life-saving devices that provide a critical intervention in cases of severe allergic reactions. By understanding how an EpiPen works, its common uses, and potential side effects, individuals can make informed decisions about managing severe allergies and when to use an EpiPen. Remember, proper training and familiarization with the device are essential for effective administration. If you or someone you know has severe allergies, ensure that an EpiPen is readily available and not expired. Being prepared and proactive can make all the difference in an emergency situation, potentially saving a life. While EpiPens are the most widely recognized option, alternative autoinjectors are available, and it is important to consult with a healthcare professional to determine the most suitable option. Additionally, taking proactive steps to manage allergies and avoid allergens can help reduce the risk of severe allergic reactions. In summary, understanding the mechanics of an EpiPen empowers individuals to be prepared and confident in managing severe allergic reactions. By staying informed and taking appropriate precautions, we can ensure the safety and well-being of ourselves and those around us. Thanks for watching.